Kia ora. I'm Holly from the Ovarian Cancer Foundation New Zealand, and I'm very pleased to be welcoming you to our webinar series. This session is part 2 of our recurrence series. The first part was presented by medical oncologist Dr. Michelle Vaughan, and it's available to view on our website. Tonight, we're very lucky to have Dr. Geraldine Tennant to present. She's going to be speaking about strategies to cope with the uncertainty or the fear that you may experience. Geraldine is a health psychologist who practices out of the Harbour Cancer and Wellness Centre, and she's a senior lecturer at the University of Auckland. After Geraldine has presented, there will be the time to answer some questions. So if you're attending live, please submit any questions through the Q&A feature in your toolbar. If you tap your screen or wiggle your mouse, you should see that option pop up. This session may be a little confronting, so if you need to log off, please do so. And the recording will be made available on our website, so you can return to it at a later date or share it with anyone else who might be interested. We're sure you'll find this session really informative, but please remember that it's no substitute for individual medical advice. Now I'll hand over to Geraldine.
Kia ora koutou, and thank you very much, Holly, for the introduction, and also very big thanks to the Foundation for this opportunity to speak to you this evening. I'm actually just going to share my screen, which I hope will allow me to share my presentation, and I'll just go back. Oh, that's racing through. Let's go back to the beginning. So as Holly said, I'm a health psychologist, and I have worked in this area of psycho-oncology, which is a big term, but it's essentially about supporting people as they go through cancer diagnosis and treatment and life beyond treatment, and also dealing with issues around recurrence. So I've worked in this area now as both a psychologist, so clinically, and also involved in research for about 18 years. A lot of what I'm going to speak to you about is really, I guess, I focus on some of the key things that people experience as they go through diagnosis and treatment of ovarian cancer. And the focus for tonight is very much thinking about the uncertainty, and often that's linked to fear of recurrence, and also thinking about how do I cope, what can I do when cancer returns. Got that image there of a roller coaster, which is for maybe some of you watching, maybe just touches a chord or strikes a nerve. When I first started my first clinical job at the Cancer Society, I was actually involved in presenting a talk named Riding the Emotional Roller Coaster. And it was very much about helping people navigate the emotions that come up from that time of diagnosis as they go through treatment and as they end treatment, and then, you know, often are still dealing with a lot of uncertainty and very specific fears. Sometimes people will sit in front of me in a counselling session and the hand goes up and down like this when I'm asked them how they're feeling or asking them about their mood, and often they will talk about feeling like they are actually on an emotional roller coaster, navigating what's coming up for them. Certainly, I hope what I'm going to speak to over the course of the webinar this evening, what I'm hoping is that you'll have some very practical ways of sort of navigating that roller coaster and navigating the uncertainty and distress that you may be experiencing. I've just highlighted there some specific concerns that may be causing uncertainty and distress. It's certainly not an exhaustive list, but often people will raise or talk about the uncertainty about their life, the disruption that cancer has caused and continues to cause in both their working life, professional life, and also their personal relationships. Often there's specific concerns about the impact on, if you do have children, on your children, thinking and worrying about their distress, how are they actually coping? There's often uncertainty that people are navigating and concerned about, am I actually going to need to go through treatment again? So this is a common concern. And then there's fearful expectation around or feelings around dying, and thinking about planning for the future, which can often be really hard to think about as you're in the thick of treatment, and certainly can be an ongoing concern once you come out the other side, or indeed living with that fear of the cancer coming back. So I suppose I wanted to highlight probably the most prominent uncertainty or coping with uncertainty that people talk about is the fear of recurrence. And I think it's important for me to really normalize and validate that it is probably one of the most common fears that people navigate. And often that can start right from the time of diagnosis. So from people are actually told that they have cancer and there's a treatment plan, they are really hooked into this fear. So it's very common. Sometimes the fear of recurrence actually arises at the end of treatment, and people are often at that point of what now? What does life mean for me now? So we can think about this fear and navigating that uncertainty is really impacting on a person's psychological and emotional well-being. And this leads into impacting on their quality of life. So they may be fearful about making plans, doing certain things. What I see in my clinical practice, and we know from a lot of research, is that often the fear of recurrence can reduce over time. And often the fear is reduced with a lot of support, and that can be about speaking to other people, thinking about certain strategies, getting one-on-one individual support, or certainly accessing support through a group. So while it can often reduce over time, people will often talk about and experience what they may say is sort of flare up. So it might be that a person's going along okay, and then they're coming up for a medical appointment or a test, or it's an anniversary post that initial diagnosis. So again, it can often be that roller coaster feeling in terms of trying to cope with the fear of recurrence. So it may be very well to say, well, it's normal, it's common.
Sorry, excuse me, Geraldine. I just can't see your slides right now. Would you want to just try and resharing them?
Sure.
Sorry to interrupt.
Were you seeing them from before, Holly, or?
No, I haven't seen them yet.
Okay.
Here we go. Perfect.
Okay.
Thank you.
So would that mean people wouldn't have seen it from the beginning, or see how we go? Apologies for that. Okay, and I'll just do a slideshow from the current slide. Right, empty screen. So as I was just saying, it's important to normalise and validate that fear of recurrence. Has been a very common thing that people experience, a common fear that can be overwhelming at times. And then it becomes about, well, how can I actually cope? What are some practical ways I can help navigate? Again, thinking about that roller coaster image. My work is very much informed by acceptance and commitment therapy, or it's often abbreviated, not often, but abbreviated to ACT. And this is thinking about, from an ACT perspective, about creating a full and meaningful life while being open and accepting to the range of emotions that we all experience that inevitably goes with it. And there's a number of strategies specifically within ACT that can be helpful for us to think about, particularly thinking about uncertainty, so how to cope with it, and particularly thinking about the fear of recurrence. So a key thing to think about from an ACT lens or perspective is the idea of contact with the present moment. And some of you may think about this as mindfulness. So this is thinking about being present, being engaged in the situation that you're in, thinking about the people who are around you. So actually really paying attention to your here and now experience. And that can often help diffuse the fear, the anxiety, or the different emotions that you're feeling. But from ACT, we talk about actually being with those emotions. So accepting the emotion that's coming up, not trying to dampen them down, but actually making room for it or allowing space for it. And often once you notice and name that emotion, it does diffuse and you can maybe go about your day or go back or engage with your task. Particularly thinking about an ACT lens when we specifically think about fear of recurrence. It can be saying things to yourself like, I don't like this feeling, I don't want it, but I can simply allow it to be there. I can really just stop fighting with it. And often we talk about stopping the struggle, so making room for the emotion. And certainly there's more in-depth work you can do with a particular therapist who is trained in ACT, or draw on some specific principles. There's a great book I can recommend by Dr. Russ Harris, and it's called, and now my mind has actually gone blank as I've said it, The Happiness Trap. And that's a book that's pretty readily available, and it's not specifically focusing on coping with cancer, but it's got some really beautiful principles to work with within that ACT lens. Other ways of thinking about coping is actually to be informed and to think about getting answers to your questions, because often when we're dealing with that uncertainty or getting into the spiral of fear and anxiety, sometimes actually being able to talk to a trusted health professional or to other people to actually get answers to the questions that are troubling you. And that may be answers around treatment, it may be answers about where you can access certain support. Also thinking about the idea of holistic well-being. So the idea of focusing on living well. And that can be really connecting into things like making a plan around your own self-care. What do I actually need to do to really look after myself? It's a common thing that I work with. A common issue is that people will often talk about the diagnosis, their cancer diagnosis is really triggered a time point for them to really think about their life and reevaluate. And often that is focusing about on, what are the things I can do to look after myself. So making a plan around self-care can be thinking about things that you enjoy, some things that you want to start to do, some things that you want to stop actually doing. And that can be things like saying yes to things, saying no to other things. So have I actually got the energy or the capacity to this? And that can often be a big switch to maybe how you usually are in the world. If you're someone that's always out there helping others, it can be quite a big issue to switch to actually being open to saying no to some things, but also accepting offers of help. And again, that's a common thing that people will talk about with me in therapy. Part of the idea of that idea of holistic well-being, so thinking about self-care, is also thinking about certain lifestyle changes. So in terms of coping, you may find that you can manage or navigate that anxiety or the uncertainty by walking, by thinking about increasing some of the exercise that you do, or actually even starting to exercise, thinking about aspects of your diet, alcohol, smoking, looking at stress management. So actually really tapping into the idea of what are the things that I can do to look after myself and navigate the different issues that are arising for me. A big part of being able to navigate the uncertainty and deal with our fears and deal particularly around fear of recurrence is to think about those, how that filters out to those who are around us. So often people will talk to me about, their partners, their family, their friends, the offers of help. There may be some barriers there, and sometimes that comes onto communication. I'll talk a bit about that in a moment. So actually, sometimes it can be helpful for you as the person going through the diagnosis process, getting a treatment plan, entering into treatment, to actually talk to trusted others, whether that be partners, family and friends, or it may just be a small group of people, that you really appreciate the opportunity to talk about your fears. Because a common thing I hear is that people often experience a pressure to be positive. So if you're just positive you'll beat this, which is really important, the mindset is incredibly important, but it's also okay to talk about the fears, to actually be able to communicate to family, to friends about what you're experiencing. Also communicating with your networks, your social networks, that you appreciate if they can listen without a focus on providing a solution. So often people will say, I've got great family and friends, but they get into a fix-it mode. And what I actually really appreciate is having the opportunity to talk, for them to listen and not try to problem solve. Because often particular things are happening, whether that's within a treatment hiccup or something's happening to you, that there may not be a ready solution, but you may find it absolutely beneficial to talk to trusted others. Also thinking about others around you to help with your coping plan in practical ways. So if you are focused on, exercise if you can, and often that's very hard to navigate through treatment, that they join you for walks, that they do practical things around your home. Again, that idea of asking for help and accepting help that's offered to you, and really thinking about the opportunity that you can communicate with what you need. A lot of what I've just talked about there actually really leads into thinking more broadly about communication. If you're needing to talk to family, friends, trusted others about your needs or how they can support you, communication is often a key thing that people need support with. Some key things to think about here is sort of initiating that communication. How do I begin that process to have those conversations about what my diagnosis means, what my treatment means, or indeed if there is a recurrence, what that actually means for me, for my family, etc. So think about basics like, is it the right time of day to be initiating some of those conversations? Often it's quite organic and things come up, in the course of your day or the course of being with family. But sometimes you need to initiate a specific time that you sit down, almost like a plan around, we were going to, meet together and talk about what's happening for me and what support I may need. Another key thing to think about is the communication and thinking about the support that you need. The communication process is ongoing, so it's not just a one-off conversation. And particularly thinking even about communicating with children, often it's, bite-sized pieces of information and coming back, and always leaving the door open that you are there to answer questions. And it can also be reassuring to say, if I don't know the answer, I'll find out and be able to talk with you about that. I've got that term there, cancer comms, short for cancer communication. And often it's important to think about sort of sharing the load, because keeping people updated as you're going through treatment and other kind of parts of your cancer diagnosis and treatment plan can actually be a burden on the person going through that. So is it a case of needing to ask for people within your support network to keep others up to date? Is it a case that people sometimes organise, meals to be dropped over on your behalf, or certain tasks or things that can help you? So that idea of sharing the load and knowing that not necessarily everyone in your network can cover off all the things that you need. You may often be even reluctant to ask them that. But sharing that load of advising people, asking people, can often dilute some of that worry and the fear that you're experiencing. Children, we could probably have a separate webinar on that around communication with children. But some key things to think about here is, again, that setting a time and a place, often to have those sort of focused conversations on what's happening with your health. Checking in about what they already know. There's a lot of information out there, particularly for older children, if you have, sort of communicating and talking to them about what's happening. So really, what's their understanding of the cancer or what's happening? And really just sort of getting the idea of getting other resources different books. There's a lot of things available online that can really support you as you're navigating, which is often one of the most challenging aspects of cancer diagnosis and treatment, supporting children and explaining to them what's actually happening. If cancer does return, a number of the things I've talked about already are applicable in terms of managing that fear and coping with that uncertainty. I think it's often important, I work with people about that idea of gaining control, often at the start, if there's been a further recurrence in that initial sort of breaking of that news from the doctor, and there's often a sense of a loss of control. And that can be gaining and maintaining control, can be tapping in again to those aspects of self-care I've already talked about. It can also be about, looking at your decision-making process. Do I need to talk to other people, get a second opinion, check in with those trusted people who are in your network, as well as your health professionals. Living well, again, this taps into thinking about what are my values. Often a recurrence can be a trigger again for what is the meaning in my life, what actually gives me meaning. I'm currently involved in a trial through the university at the moment. I'm one of the therapists on a trial where we're using meaning-centered psychotherapy, and this is for people with advanced cancer. And at the sort of cornerstone of that therapy is actually working with the different types of meaning that we all have in our life. Who's important to me? Choosing the attitude as well is a key thing that informs that therapy, but something generally for us to think about. And that's not a kind of, yay, I've got cancer kind of attitude. It's actually thinking about, how can I gain control, talk to people, get that support network around me. So finding meaning in the context of cancer returning or a recurrence, again, is often a key thing that people want to work with and focus on. And it's often a real privilege to be alongside people as they're navigating that stage. So getting information, talking, as I said, to other medical professionals if that feels appropriate, reaching out to support. I'm going to sort of touch a bit more on that in a moment, where you can think about accessing support, because often people will realise at this point that they maybe need extra support. Often people haven't accessed the range of support that's out there until this point. So there are a lot of things that you can draw on to navigate. I suppose it's also just to think about when you should consider getting that extra support. So as I've already said, it may be that the recurrence has been sort of the trigger or the impetus to reach out and maybe seek different types, different levels of support. But often, if you're feeling that you're very overwhelmed, so that you may have tried even some of the things I've talked about now, or you do have good self-care and good practices in place, but you're actually feeling overwhelmed on a day-to-day basis, feeling stuck, feeling unsure about what to do, it's often a time to think about getting extra support. And maybe that you stop doing things that are important to you. And this is often a key experience that people sort of tap into, or they move into that point of not doing a lot of things that are important or meaningful, because the fear of recurrence is often really high. And there's that fear, well, if I do this plan or go away or make the change, what does that actually mean for me? And it may be that you don't go on a family holiday or spend time with people who usually would, because you're feeling so fearful, and there's that spiral feeling. So often that's linked into, and I've got just that last point there, family or friends noticing that maybe there's been quite a significant change in how you are. They may often suggest about that, acknowledging their main support for you, but this may be the time to reach out and get some other support. And those 2 points in the middle around stopping things that are important for you, finding it hard to enjoy your usual activities. As a psychologist, I would often look at that and think that may be an indication of low mood or depression. So those are really kind of maybe slightly, you could think of them as flags that, I'm in a space where I'm overwhelmed and I need some support. You may be feeling that, and or family and friends are noticing those changes. So if you're wanting to get extra support, who can actually help you navigate? And that can be navigating emotions, it can be looking at reaching out for support around communication, seeing other medical health professionals. A good first point can often be your GP. They may be able to do appropriate referrals, link you into other services. You may have an ongoing relationship with a nurse specialist. That may be through the hospital where you're having treatment, through the clinic that you're having treatment. You may also have one of the cancer community nurses, perhaps through something like the Cancer Society, who come and see you, and they may be able to be a sort of a bridge or a pathway to linking you in for psychological counselling support. Maybe that you're able to talk to your oncologist about what you're thinking and feeling, and you'd like some extra support. You may then link into seeing somebody like me as a psychologist or a counsellor or a therapist, or there may be specific things that you look to do, mindfulness courses, specific training, etc., that's going to be helpful. There is a range of community and online resources, and certainly the online resources that are available now have really developed, particularly over the last few years with COVID. There was a time when there wasn't a lot offered online, and that can be from joining a webinar like tonight. It can be from joining online support groups, listening to pre-recorded resources, or actually going online and looking at what's available. And one of the most powerful things for others is connecting with women who have experienced or are experiencing ovarian cancer. And that can be sometimes linking with someone one-on-one. It can be joining a support group, and that focus is about, connection, fellowship, and having often, people will talk about a safe place to fall, in terms of having that safety of talking with others who have gone through the experience or going through the experience. And that can be a very powerful thing for women to do. Again, acknowledging that that may not be for everybody, but it's important to consider that there's a range of things and resources you can connect to, whether that's on an individual level with seeing a counsellor, through the community, and or connecting to other women individually or within a group. And sometimes people talk about that, apart from maybe the flags that, I need to talk to someone, some of these things are helpful at different times. So often a support group may be not right for you at the beginning of your cancer experience, and you connect to other things later. Certainly in my role as a health psychologist, I would see people at different stages of their diagnosis and treatment experience. And often it's not till they've finished treatment, whereas others will connect right at the beginning and connect into that support. Last slide. So I've got there actually my email address, geraldine.tennant@extra.co.nz. If there's anything in terms of questions that you wanted to email through to me kind of offline or at a later date, I'm very happy to receive those and connect with you. But I think I will stop now and look, I might just stop my share now, if that's okay, and look to questions, which I think have come up in the chat. So thank you.
Yeah, thank you so much, Geraldine. So if anyone has a question, just do please wiggle your mouse or tap your screen and you'll see the Q&A, and please send them through.
And apologies, I didn't see that is coming up, that they couldn't see my slides, but for the second part they were there, so apologies for that.
Okay. Just while we wait and see if there are any questions that come through, I did have one. I know that spiraling thoughts can be something that can happen quite easily, and it's kind of hard to break out of that momentum once it begins. Do you have any suggestions for techniques to kind of recognize when that's happening and to get out of it?
Yeah, so that's a great question. Thanks, Holly. So often the first thing people will talk about, say the thoughts are there, but often it's a physical response first. So you know that you're feeling a change in your body, you're feeling anxious, and there are thoughts there. Often it's one or two things that keep going around. It's fear that I'm not coping with treatment or something's coming back. I'd really suggest maybe something like what I'd call a grounding exercise, so that you sit and you breathe, if that's possible. You notice what's around you. So it might be that you can see different colors of things. You can feel your feet on the floor. You can take that breath. And then the grounding is that, it stops often that busyness, that busy mind. Other ways you can cope with that is a sort of distraction exercise. So often people find it quite helpful to be busy, to go and do things, and distract from those thoughts and feelings. Writing things down can be helpful as well, and actually looking at, what are my recurring patterns of thoughts and how I can maybe look at those differently. And sometimes that's where the counselling or psychology help comes in, to help people with those big, scary, overwhelming thoughts.
Yeah. It doesn't look like we've had any more questions come through. So I'll say thank you again, Geraldine. And I will also just take this opportunity to remind people that we do have an online peer support group. It's facilitated by a counsellor, Lisa Almond, and if anyone is interested in learning more about it, you can email us at support@ocfnz.org.nz. And yeah, next month our webinar is going to be on the topic of menopause, so please do keep an eye out on your inbox to learn more about that. Thanks again and good evening.